For today, to start, we have 1,293 new cases of COVID-19 diagnosed today, bringing the total number of people with COVID-19 in British Columbia to 108,278. I will note that these numbers were reported from our Plover system and may be adjusted once we get our regular system up and running. There was a delay in its refresh today. Of the new cases, 448 were in the Vancouver Coastal Health Region, 645 in the Fraser Health Region, 69 were in Vancouver Island, 80 are people who live in the Interior Health Region, and 51 are people in the Northern Health Region. We currently have 9,184 active cases across British Columbia, of whom 336 are in hospital right now, 101 people in critical care or ICU, and an additional 15,203 people under active public health monitoring. 97,462 people are considered recovered. In the last 24 hours, we've had an additional 2 people who have died from COVID-19 in British Columbia, bringing that total to 1,493. And our condolences continue, and our thoughts go to the people who have lost loved ones. We have one new outbreak at the Seagull Family Health Centre in Vancouver Coastal, and the Ridge Meadows Hospital outbreak is now over. So that leaves us with 4 active outbreaks in long-term care, assisted living or independent living, and 7 in acute care facilities. Just to go quickly, to date we've delivered 995,001 doses of all 3 COVID vaccines across BC, and we know the Get Vaccinated online registration and booking system is now available for people. I'm going to go to the presentation here. As we have we've shared, we're actively monitoring the strains of this virus that we see in British Columbia over the past year, and I'd like to share some of the additional data with you here today. So as you know, variants of concern are the latest issue that we are looking at, and this has emerged, and I want to put it in a little bit of perspective. Okay. So the variants of concern are those variants for which there's evidence that we see from around the world that there's increase in transmissibility, more severe disease, reduced effectiveness of treatments or vaccines, or challenges with diagnostic tests. And as a result, we do know that these some of these variants of concern, particularly the ones we've seen from the UK, the B117, are likely to overtake and replace current circulating strains. And we have seen that happen across the world and here in British Columbia. One of the things the goal that we want in terms of what we are looking for with these variants of concern and our surveillance that we're doing in British Columbia, which has evolved over the last few months as we've developed more tests, is to monitor our vaccine effectiveness. That is one of the most important things. Monitor the performance of diagnostic tests and understand the evolution of the viruses that we are seeing causing infections in British Columbia over time, and their impact on things like burden of disease, how many people are getting infected, how many people are in hospital, and how many people have severe outcomes. We also know that existing health measures that have been shown to control all of the strains of the SARS-CoV virus, including the variants of concern, including public health case management, contact tracing, as well as clinical care and infection control measures that we need to take, remain the same, regardless of what strain somebody is infected with. So this is the evolution of what we've seen in British Columbia over the past year, and this is what we call a phylogenetic tree. And we've shown some of these over time in the last few months, and as early as last March and April. And what we can see is the number of different strains or slightly different versions of the virus that we have seen in British Columbia has changed, and we've had a much increased number of different strains over the past year. So from March 2020 to March 2021, we've gone from a few dozen to over 100. What we've been looking for, particularly in the last few months, is whole genome sequencing helps us to understand what types of strains are circulating and where in different areas of the province. So this whole genome sequencing has changed over time. We've increased our capacity, so we've done a larger percentage of positive cases, and we have new tests, screening tests, that help us understand when something might be a certain strain or a certain variant. And I'll talk more about that in a minute. So we do what we call direct PCR to screen for these mutations, and some of those we'll talk. So what we have seen here in British Columbia is that the series of strains that we saw from last summer until early in this year, and you can see that on the bottom of this slide and the colors, they've mostly been replaced, and they've been replaced by a number of different strains. Importantly, we're starting to see a lot of the B117 strain, and that is not unexpected. By the time we recognized that this was a strain that had increased transmissibility, it had already been introduced in British Columbia, and we were able to detect it from very early on. We knew that this was likely to spread more easily and to cause more people to become infected, and we have indeed seen that. And we've seen that this strain has replaced much of the other strains that we've seen. We've also seen a lot of the B12, which is one of the regular strains, not what we consider a variant of concern, but it is one that's been causing a lot of illness over the last few months. The B136 and the 1351 are ones that we were watching carefully as well, and we saw a little bit of them, and then mostly them going away. And most recently, in the last few weeks, we've seen an increase in the P1. And part of that is artifact in terms of we are testing more people that are in clusters that are now related to P1, and the type of screening tests that we've been doing in some labs in the province are designed to pick up that variant in particular. And that's why we are moving to a more systematic surveillance strategy so that we understand the relative importance of different strains and are able to detect new strains as they evolve over time. This is just an example of the numbers of different strains that we found through this whole genome sequencing as of April 4th. And what we call them are lineages, and ones that we want to investigate to see if they do have features that make them more concerning. And I will say that we're not alone. This is something that around the globe people are trying to understand. What is the impact of these different strains? How do we tell if some of them are going to turn out to be more transmissible or cause more severe illness? What are the specific mutations that we need to worry about? And those are all things that are ongoing conversations in BC, in Canada, and globally. And just today, with a number of our lab colleagues, we were on a call across the country to determine what we define as a variant of concern or a variant under investigation, and what criteria we're going to use, and how does that allow us to talk to other countries around the world about the variants that they are seeing. I will also say it's really important to know that we do a lot of whole genome sequencing. So we have a better understanding, and we have increased numbers relative to many other provinces, and in Canada relative to many other countries. We do a lot more proportionately, for example, than the United States in its entirety. And we do very similar proportions of screening and whole genome sequencing to countries like the UK. When we started to see variants here, and we started to understand that there were some different mutations that made a difference in that variant being more transmissible in particular. And so this is an example of these different types of mutations that we see with a bunch of different viruses. And these are all profiles, we call them, of variants that we've investigated, that we have concerns about, that were found here in British Columbia in the last few weeks. And what we can see is that many of them share the same mutation that worries us. And the one that has been associated in particular with the UK and with both the South African and the P1 that we saw from Brazil is called the N501Y. So that's a specific mutation that's of concern. As we've learned about these mutations, different laboratories in the province, including the BC CDC, including the lab St. Paul's, and a number of other laboratories, have developed special PCR tests, so these screening tests that pick up those different mutations. But as you can see, those mutations can be with a whole variety of different strains of the virus or different variants. So we do the whole genome sequencing is the only way to tell for sure if it is a Brazil versus a South Africa versus a Philippines. So that is why we have that strategy of doing whole genome sequencing on the screen positive tests. As we've done more, the screen positive tests can be done on the same day, but it's not as specific as we see. In the last few weeks, as we've ramped up our ability to do whole genome sequencing, and as we've developed more and more of these PCR tests, and we've targeted who gets tested with these screening tests as well, we are finding that they are quite accurate, and they give us a good sense of the fact that we are seeing quite a rise in the B117. So we need now to shift our strategy so that we can use the whole genome sequencing capacity we have in British Columbia to do more systematic testing and sampling of all of the strains to make sure we're not missing another important one that may be arising. And we don't need to test so much anymore to understand if we have the UK strain here, because it is here and it's increasing and it is causing more transmission in communities around the province. But we're focused right now, we're seeing a lot of it, particularly in the Fraser Health region. The P1 was one that was relatively new. We did a lot of focus testing in the early weeks with the chains of transmission and the clusters that were identified with P1. So now we don't need to spend as much time understanding that because we have now seen that strain as well is in a number of chains of transmission around the province, and we need to pay attention to the important measures that we need to take with all of these strains to stop transmission. So as I said, we can't tell with the screening test alone whether it's that exact variant of concern or not, and we need to look at whole genome sequencing in a more holistic way around the province to understand which strains are going to be replacing others, which strains are increasing, and whether there's other concerning ones that are coming now. So our strategy moving forward, given this high rate of transmission or high rate of VOCs that we're seeing in British Columbia, will be to no longer routinely sequence for confirmation. We just assume that those screen positives will be the variants. We assume that anybody who is positive with for COVID-19 needs to be treated as if they have one of these highly transmissible viruses. And we will have a proportion that will be sequenced for continued surveillance over time, so we understand what is changing in our environment over time. And that's what we will be reporting on going forward. And we'll be doing that in a systematic way as part of our weekly surveillance reports from the BC CDC. And that way, our whole genome sequencing capacity can help us understand new transmission chains or clusters or outbreaks and help us understand how we can best manage those outbreaks, determine the proportion of travelers who have variants of concern, and really importantly, monitor for the things that make a difference in how we are managing our pandemic here in BC. And that is to monitor for reinfections, for vaccine failures, and for what we call escape variants, variants which may not respond as well to our immunization program. So that's an important piece that we have been evolving as we've understood more about the variants of concern in British Columbia right now. The other thing that we have been concerned about and been monitoring very carefully is the rates of hospitalization by age. And we've talked about this, about the fact that we are seeing younger people in higher numbers in our hospitals. But it's important for us to understand if that is higher than we would expect, or if that is because we have increased numbers of people becoming infected and the rate of hospitalization is the same or higher. So when we've done this analysis, we've looked at September to February of 2021, and then the period that we're most concerned about, which is really over the month of March, to see if there has been a difference since we've started to see that increasing rate, particularly of the B117, but also the numbers of P1. And what we can see here is that for the most part, we are not seeing an increased rate of hospitalization by age. The one exception to that is, I think, a reflection of our immunization program, where we have seen a higher rate of hospitalization in people over the age of 80. And this very likely reflects the fact that most of the people over age 80 who were infected with SARS, were CoV-2, were people in long-term care. And this reflects the effectiveness of our program and rates going down in long-term care. So people over 80 now, and it's a small number, but this is a rate, so it's a number of infections, and that means that people in the community who are being infected are more likely to be in hospital and to get hospital care, to need hospital care. So I think that's a reflection of the effectiveness of the long-term care immunization. So this is something we will continue to watch very carefully, because this does give us an idea of where the variants are having an effect on people. If we look at the analysis of hospitalization by the people we know have these variants of concern, we have a hospitalization percent of about 4.2% in people who were diagnosed with COVID-19. For people who were not sequence positive, so this is at the time where we were doing sequencing of the high proportion, close to 90%, the hospitalization was about 4%. For people who were identified as having the B117, and that's about 2,300 people, the hospitalization rate was slightly elevated at 5.2%. So that's something we will need to continue to watch. That's about 120 people in March who were hospitalized. And the confidence intervals with people who were not VOC positive is slightly overlapping, but that's a concern. It tells us that we need to continue to watch and to see if the B117 is associated with higher hospitalization rates. The P1 variant, we saw the hospitalizations rates were not elevated, but again, a very small number. So only 36 people were hospitalized with P1 over the month of March. So that's something, again, we need to continue to watch. If we look at the age group of people who've been infected with the variants of concern, the two that we are most concerned about, or that we're watching most carefully, what we can see is the B117, it really does reflect people who are the same age bracket as non-VOC. But for the P1, and partly this is because of the testing, and partly it's because of where the chains of transmission were happening, and it's primarily in the Vancouver coastal region, although we've seen clusters in every region, so far not the north. We've seen a much lower age group of people infected. So 20 to 29 and 30 to 39 are overrepresented in the P1. And that's a reflection, again, of where the outbreaks are happening and the increased transmissibility in those outbreaks. So finally, if we look at the rate of hospitalization per 100 cases by variant of concern and age, so putting those two things together, what we see for the B117 is that we are not seeing an increase across most age groups. We've seen a slight increase, as we saw, in 80 plus. for people who have the 117 compared to those who don't, but it's very small numbers in that group and a very wide confidence interval. So the gray and the pink, as you can see, so the bar on the left and in the middle are overlap for all of the age groups. But we need to be concerned about the 60 to 69 year age group and the 50 to 59 year age group, where it looks like there might be an increase for both the 117 and the P1. The challenge with the P1, and that's reflected in the very wide confidence intervals, is we're talking about very small numbers of people. So that means that those numbers are unstable, and we can't be for sure, but it's a signal that we will be watching. So there were 10 people in the 60 to 69 year age group that were hospitalized, and 9 people in the 50 to 59 year age group who were hospitalized with a P1 variant. So again, this tells us that we're not seeing a dramatic change in rates of hospitalization by age or by variant, but a signal that we need to continue to monitor, and that's how we will be making sure we're targeting our testing over the next few months. Finally, I just want to talk about how our immunization program and how we can look at proportions of people who are immunized and the effect that we're seeing on hospitalizations and deaths. And what we can see is the 80-plus group, where our immunization program is going very well, and we've targeted that group, had the highest hospitalization rates, the highest rates of death. We've seen a dramatic decrease. Despite increasing numbers and increasing hospitalizations, the impact of the immunization program is felt along all age groups. And that is an important thing for us to remember as we get through the next few weeks and make sure that we get as many people immunized as we can. So to go back to our variants of concern, we will be posting the numbers in the next little while, just of the tests that we have done and by health authority, just so people are continuing to have that information as we transition to doing our more systematic screening and make that part of our weekly surveillance reports. So we do know that we are having increased numbers of people who have been infected with COVID-19, and part of that is, as we just saw, driven by the increased transmissibility of some of the strains that are circulating in BC right now. Workplaces continue to be areas where we have seen ongoing transmission chains and outbreaks and clusters across the province, but particularly in the Lower Mainland, and they are driving some of the transmission that we're seeing. And whether it's some people having, workers having a social interaction and bringing the virus into the workplace and then it's spreading, or whether it's in the workplace itself that the contact is happening. They are one of the most common sources of transmission in our province, and it is widely across many different sectors. We've been working on this with our workplace task group for several months and trying to understand systematically which workplaces are at highest risk and how can we manage outbreaks and clusters in those workplaces. We've been doing this with public health, and our medical health officers and environmental health officers do this every day. And we are targeting businesses. We've been working as well with WorkSafe BC to ensure that enhanced COVID safety plans are in place and that people are adhering to them. In several cases, in many cases, we have had to close workplaces to break those chains of transmission. We've provided immunization in many of the highest risk workplaces that were determined by our workplace group and by the work that we've been doing together, particularly in those workplaces that can't be done remotely. So we've focused on food processing plants, on some of our food distribution plants, the farming areas where people are in group accommodation. So this has been an ongoing program. And part of our ongoing work together has been to work with WorkSafe BC to augment the work of public health. And as part of that program, I'm putting a new expedited workplace closure order in place today. And this order allows WorkSafe BC inspectors to operate under the Public Health Act with guidance from medical health officers to support the work that we're doing in workplaces when there is workplace transmission to help manage those outbreaks. When 3 or more workers have COVID-19 at a workplace that's determined by public health to be transmission in that workplace, we have an outbreak protocol that includes testing, that includes investigation of how that transmission might happen. And when it's determined that transmission has occurred at the location, public health will close that workplace for a period of time, for 10 days or longer as needed, as one of the measures to limit spread in that workplace. In larger workplaces, this closure may be restricted to the locations where transmission has occurred. So one of the places where we see this is at construction sites, and it may just be one team in the construction site that may need to be off for a period of time. We also are working closely with the protocols to make sure that we work with each workplace to provide advice around the COVID safety plans and where transmission events is happening. So when a closure is ordered, WorkSafe BC will now be able to support the work of public health and serve the closure notice and support the workplace to review and enhance their safety plans as needed. We recognize, of course, there are many workplaces that cannot be closed, that for public interests, of course, we need to keep them open and functioning, and those will be under the guidance of public health as well. So such workplaces as police stations and fire halls and our healthcare facilities, transportation hubs, some of the distribution hubs of necessary goods and services, grocery stores, pharmacies, these are places we know we cannot close, but we now have extra resources to help support those workplaces when we have workplace transmission and worker safety is at risk. As part of this as well, we will have a list of workplaces that have been closed and the dates of their reopening, and those will be posted publicly for people. So this is just an ongoing part of our program to help control the outbreaks and a more targeted approach to workplaces across the province to help us make sure that we are keeping things functioning as safely as possible and to avoid the need to have sector closures that are really a blunt tool. In this case, we can keep people working safely, and we can augment the measures already in place and support public health and businesses to control outbreaks and to prevent outbreaks in businesses going forward. About a year ago, we asked people to share their perspectives on experiences in our province-wide Your Story, Our Future survey, and over 400,000 people took the time to complete this survey, which is a record number by all accounts. The information you shared has helped guide our response to the pandemic through this past fall and winter. And today we're asking you once again to share your feedback on how COVID-19 and this pandemic has affected you, and what tools and supports you need as we look ahead to our pandemic recovery in the coming months. So we have a new updated version of the Speak survey. It's called the Speak 2. It's available on the BC CDC website, again, bccdc.ca, COVID-19 survey. And I encourage everyone, once again, to participate and to help those who don't have online access to participate as well. So what we have seen over these last few weeks is a notable increase in transmission across BC. And I don't need to tell people that. We all see that. We have also seen new cases in younger populations, particularly in the 20 to 39-year age group, and much of it is being driven by our social interactions and then amplified in places like workplaces. These gatherings with different people in different places on different days are fueling the spread of the virus that we're seeing. And these variants of concern are making that much more easy. When you spread the virus to somebody, you bring it home to others. It's not just one or two people in a family or a household that are getting sick right now. What we are seeing is that the transmissibility is spreading so rapidly. It's everyone in a household or a community or accommodation that is becoming ill. Yesterday, I had the privilege and the honor of visiting a number of our frontline healthcare teams in Vancouver Coastal and in Fraser Health. And I can't tell you enough how proud I am of the work that they've been doing and how important it is that we support them. We should all be proud of the incredible work that is being done every day by our critical care teams, by our teams in the emergency departments, on the COVID wards, and in all of our hospitals. But I will tell you as well, people are tired. Healthcare workers are tired. The doctors and nurses and care aides and the cleaners and the respiratory therapists and the nutritionists and all of the people that are keeping people alive and saving lives every day in our hospital systems are tired. They are ready for this pandemic to be over too. And I heard again and again that they are very concerned about the disheartening signs that we are seeing, that we are seeing hospitalizations increase, that we are seeing whole families need to come in for care, with mother and father being in the ICU and having children who are on the COVID ward, adult children. And when we see sometimes the things that are happening with parties or events or people not taking it seriously, it's very hard for us to see that from the inside of a hospital. Despite the fatigue of our amazing frontline health workers, they are here still to support us. And we need to show them our support too. This virus has spread by people, and we have said that from the very beginning. And we spread it to the people that we are closest to, whether we have symptoms or not. We spread it to the people we are closest to in our households, our family, our workplaces. And these new strains are making that easier and easier. We need to show our healthcare heroes that they have not been forgotten, and that we do that by doing our part every day to follow the orders we have in place. We have strict orders about not socializing with people outside your household. It is not okay to have friends and family over right now. It is putting them at risk. It is not okay to go on a weekend getaway. That is not essential. Nor is your ski trip just because you have a pass. It's not okay right now to have a wedding, a birthday, any of these ceremonies where we come together because we are putting people at risk. And those people are the ones that we are closest to. All of these need to be postponed for now. All of our connections need to be done safely. We need to go back and remind each other that we have the means and we know what to do. Small connections, safe connections, wearing masks, keeping our distance, staying outside rather than inside, using all our layers of protection right now, all the time. We have vaccines on our side, and we know the measures we need to take now as we get more and more people protected. But this virus, in its many different forms, will take any advantage it can, and with the increased transmissibility that we are seeing, we need to step back now and stop having our social connections that put our loved ones and people we don't know at risk. Show our healthcare workers that we have not forgotten. We know how to do this. And we know how to do this because we have been through this pandemic together, and we will get through it together.
Thank you very much, Dr. Henry. I'd like to start by passing on my condolences to the family, friends, and caregivers of the two people who have passed away from COVID-19 in the last 24 hours, one in Interior Health, one in Vancouver Coastal Health. And we know, in part because of the restrictions that are in place, that this is a difficult time to grieve, and I think on behalf of everyone in BC, I want to pass on my support, and people know that when people pass away from this terrible virus, that we grieve with them, all of them, every single one of them. I wanted just to comment briefly on our partnership with WorkSafe BC and making our workplaces even safer, and the measures that Dr. Henry has described. I express my appreciation to businesses around the province. Over the next couple of days, we will be meeting with business groups around the province to talk about the effect of these orders, which will come into effect on Monday at midnight, or Sunday night to Monday at midnight. And those orders, and allowing us to use the incredible teams and workers and enforcement officers at WorkSafe BC to support them, we hope will target in specific transmission in workplaces and provide support to those businesses and those workers so that they can, in the cases that they get sick, get well, and to be able to perform their work safely. Obviously, we're going to continue, and there's a public interest provision that will support the continuation of all sorts of important and essential distribution networks and grocery stores and pharmacies. We'll be working with business over the next couple of days to let them know both the effect of the order and the fact that we believe that this targeted approach will help both them deal with cases with transmission of COVID-19 should it arrive in workplaces, and obviously to reduce transmission for all of British Columbia. We received a number of questions the last number of days about hospitalizations. 336 people hospitalized in BC, 101 in critical care across the province. Received some questions about the supply of ventilators in BC, and I just wanted to let people know and put this on the record. Our total in-service ventilators in BC are 730. We have quite a few more ventilators held in reserve, and of course have added to our supply since the beginning of this pandemic. At the moment, for all reasons, about 146 of those vents are occupied, 40 of them occupied with patients positive for COVID-19. So our occupancy of our total in-service ventilators in BC is 20% at the moment. Obviously, the supply of ventilators is not the significant issue. It's the supply and support for our extraordinary staff who've done across critical care, in particular in BC, on a world scale, some of the best work done by any healthcare workers in the world in supporting people in critical care. It's them that we're, of course, most concerned about in supporting and ensuring that they have what they need to deal with this very difficult and challenging moment in the pandemic. Some questions have been raised, and I just want a few things about our immunization campaign. I think one number was incorrect that Dr. Henry had. It's 985,001 doses of vaccine have been delivered in BC, 87,564 of which are second doses. As all of you know, we have two parallel programs running. Our age and risk-based program that is open for people over the age of 65, and we encourage everyone born in 1956 or earlier to phone in and register, and in the coming days they'll be sent a note so they'll be able to book their appointment. Our Indigenous population and our clinically extremely vulnerable. And in addition, we have a pharmacy-based campaign now related to involving the use of the AstraZeneca vaccines, and it's open to people from 55 to 65, and is being expanded from Metro Vancouver to communities around BC. And you can visit health authority websites and BC Pharmacy Association websites for a list of the participating pharmacies. We're making excellent progress with the supply that we've been provided. 44%, approaching half of our population over the age of 65, has received a dose. Well over 80% of those over the age of 80 have been vaccinated. Provided vaccination, of course, in 100% of long-term care homes and assisted living homes across our acute care system as well. In a matter of days, we adjusted to the safety signal for AstraZeneca and worked with the BC Pharmacy Association to distribute tens of thousands of vaccines to over 100 pharmacies in the Lower Mainland. And this ensured that our vaccines did not outdate the ones that we had received from the federal government in March. We are ready to receive vaccine and to deliver that vaccine to people as quickly as possible. On Tuesday, April 6th, we launch our online platform and provincial hotline for registering and booking hundreds of thousands of people over the age of 65, our Indigenous population, are clinically extremely vulnerable. As of noon today, 487,726 people have registered, and 81,047 people have booked appointments using the system. And this is an extraordinary response from the public. With every person vaccinated, we're all safer. I just want to go over the numbers just so that we understand where we sit with vaccines today. As of today, BC has received 888,810 doses of Pfizer vaccine. 750,052 of those doses have been administered, and the remaining 138,758 doses, the majority of which have arrived this week from the federal distribution system, are in health authority clinics going into arms in the days ahead. We get it, we use it. Moderna, and with respect to Moderna, we've received 248,900 doses of Moderna vaccine. Almost 80,000 of those doses have arrived since April 3rd, less than a week ago. These 80,000 doses were expected to be received the week of March 22nd, but we received them well over a week late on Easter weekend. Further, our allocation from the federal government of 105,900 doses that we were expecting this week is now expected to arrive later. Despite the unpredictability of deliveries, we are administering the Moderna vaccine as efficiently as supplies allow. And finally, with AstraZeneca, BC has received now 265,800 doses. And as you know, the 180,000 of those doses came in at the end of last week and are being distributed and will be administered through pharmacies, and that is happening right now. We need to vaccinate BC quickly, and we're ready to do that. As people know, I think, and I say this with respect to some of the discussion from the federal government this week, the real issue with vaccines is the amount of vaccine we have. If we could get 1 million more doses, we have the system in place, we have the capacity in place to deliver that and to deliver that quickly. The key issue is doses. And there's always, I think, an effort in these things to ascribe blame. The decisions to give up our domestic manufacturing capacity of vaccines were made in the past. And the reality is those countries that are most ahead in terms of receiving vaccines are those with domestic capacity. The federal government is working extremely hard, given that circumstances, to bring doses to us. And I offer no blame for them. But I would say this, that we are capable and able and are delivering vaccine at a rapid rate here in BC. Only thing constraining that is the amount of vaccine we have, and any time vaccines arrive is a day for all of us to celebrate everywhere in BC. And I just want to repeat that those over the age of 65 and over, 1956, born in 1956 and below, should go online or dial in and register. In closing, we've faced challenging times before. As you know, as of April 7th, as I just said, 897,437 people have been vaccinated with dose 1, and 985,000 doses have been received. That's 20.87%, or more than 1 in 5 of those eligible to be vaccinated. But this is a time, and it's clear, that our fight is not over. We need to keep doing what we know is right. We cannot put each other at risk. We cannot undermine the vaccine's effectiveness. That's the safest route for us to take to keep moving forward. Until we've had our shot, and then some weeks after that, we have to, regardless, all of us, vaccinated or not, continue to follow public health orders. It is vitally important right now that all of us do so, that all of us follow public health guidance. That is the way that we can again flatten this remarkable curve and make everyone in BC safer.